All right, good evening, everyone. Bimisola here. Apologies for starting late. I just had some technical difficulties, but we started, and I'm just going to share the video. Welcome, everyone. Let's just quickly share the video. Um, so everybody can see us and they can hear us. Welcome on Instagram. Good evening. Good evening. I couldn't even join my Instagram the normal way. I have to use my phone. Okay, but let me just share the video to our group and then we can start. So, welcome to ATP Live Monday. It's a program where you can ask any questions that you may have about the health of your children, and you get immediate answers live from a pediatrician. Program is brought to you by Hacks the Pediatricians Foundation. Okay, so I'm just quickly sharing the videos to all our groups. But if you're already here and you have any question about the health of your children, feel free to ask your question and then I will start answering them as long as I'm done with all the usual sharing and pinning. Thank you so much for joining me. I hope you've had a lovely, lovely Monday. My Monday is always crazy and busy, but I still have to be here. So thank you so much, everyone. Welcome. I hope you can hear me and you can see me. Yeah, apologies for the late start, but I guess I didn't start my technical setup on time. So um yeah, okay. So I think I'm almost done now. I just need to pin the video and we can start. So if you have any questions about the health of your children, feel free to ask now. And then we'll try and answer them. I can't see any question on Instagram yet, and I think I'm still trying to get the group sorted. Okay, so feel free to start to drop your question. Remember to start with the age of the child. And remember to be concise and give us relevant information about the question you are asking. Okay. And what specifically you want us to address in your post, in your question. Don't just leave information and not ask questions. People do that a lot. It's amazing. But we get that a lot. People just drop information and they don't tell us specifically what they want the pediatrician to do with the question. So please, we don't like to make assumptions. So I would prefer if you just tell us specifically what you really want us to do or you want us to address in your question. Okay, if you are asking on the groups, remember that you have to click on the video so that I can see your question, because if you drop it straight on the group, I may not be able to see it. Okay, all right, okay, I'm back now. I think I have a lot of questions already. I'm just trying to put my phone down so I don't have to get it tampered with a lot. So good evening, everyone, and welcome once again to ATP Live Monday. ATP Live Monday is a program brought to you by Atp Pediatricians Foundation, where you can ask any question that you have, and I will try as much as possible to answer them in 1 hour. But if you still have any questions after the live session, remember that you can always go to our Facebook group and post your questions there, and we will also answer them from Mondays to Saturdays. Our groups are not open on Sundays because I do get a lot of questions about I can't post on a group, I can't post on a group. Thank you. So show us that how much value our group has added to many of us, and we've been doing that for the last 10 years. Next month, July, will be our 10th anniversary. So and we are grateful to God for the opportunity to impact lives in the last 10 years. So this program is just one of those programs. So this time you have opportunity to ask and get answers to your questions live and direct from the pediatrician. But if you are watching the recorded version, or if you are watching after the live session, you can watch the video in case somebody has asked your question, but feel free to see um, go to our Facebook group and ask your questions there, and we'll try and answer them. And I was so impressed. Somebody sent us a feedback last week about, just ask, you never know how much important some of these questions or how far they go. Somebody came back and asked what looked like straightforward, simple question, but go see the pediatrician, and then turn out to be something very serious. A child with appears to have what look like a seizure, and the child actually ended up having a brain tumor. That's why we say you don't take symptoms very lightly. And some people get upset when you say go and see us in the hospital because they feel like you're already a pediatrician. Why can't you just solve my problem here? There are some things we cannot solve online, and there's some things that the child has to be seen for. And I'm happy the mother went, even though the outcome was not pleasant because the child died, but at least she was happy that she was able to get her child help as much as she can, had surgery and all that. So this shows the importance of, this opportunity to ask questions and be guided and be directed. So thank you so much for joining me this evening. Apologies once again for starting late. I have some technical hiccups, but I'm happy I'm here now. All right, Ada Winner Unite UD. Good evening. Please, can it be a 1 year and 8 months start school? That's a very important question. And okay, I would just say that it depends on what you call school, because I find out that what parent calls school is not the same thing as for what we pediatrician call school. In fact, for us as pediatrician, we have what we call preschool. And usually for us, any child below the age of 5, in fact, the age of 6, is a preschooler. So, by virtue of that definition, it means everything you do before the age of 6 is not school yet. As far as the pediatrician is concerned, we classify those children as preschoolers. But I understand when parents say school, they just use the word school as a generic term for any form of setting the child is going to um, outside the home environment, really. So things like even crash, things like playgroup, things like nursery, things like kindergarten. So parents call them schools, but for us as pediatricians, we don't call those ones schools. We actually call them preschool settings. So they are not technically school. So when you ask a question like, can a 1 year, 8 months old go to school? The technical answer is no, because a 1 year old cannot go to school. But I guess what you meant that can a 1 year, 8 months old child go to like a play group or nursery or even crash? Okay, the answer can be yes to that. As much as possible, we want the children to be home. The first 3 years of life of a child is the most crucial part of their life. It is very important for bonding. It's very important for what we call the right attachment and other. And we want those 3 years to be spent with the mothers as much as possible. Okay, but sometimes it's also good for children to learn to play with other children. So even though you call it school, technically they are not going to school, they are just going to play, to socialize with other children. So we call it play group. And it shouldn't be more than 2-3 hours in a day. So all this one that you people are putting children, let me not say you people, all this one that some people put children in settings at this age that they will go in the morning and come back at 6 p.m. That is actually child abuse. So for a 1 year, 8 months old, that child should go to a play group, maybe maximum 2 hours, and then they should be back home. But I know some of you are working, so your children are going to crash. So crash is not technically a school, just like a child care setting where the child can eat and then have other adults take care of that child. So if that's the scenario, some people do it as a wraparound and the morning to evening, that's a different setting. But when we talk about play group, yeah, a 2-year-old can go to play group, but as much as some children should be home with the parents, and they shouldn't be there for too long. And for us, school starts at when they start primary school. That is school. And usually that is around 6 years old. So pediatricians refer to any child before the age of 6 years as preschoolers. Then we talk about 6 to 12 years as the school age children. Then we talk about 13 to 19 as the teenagers, or we can also call adolescents, which is 10 to 19 as well. So we have different way of classifying children, but all those children below the age of 5 or 6, for us, they are still preschoolers. All right, I hope that's helpful. All right, Dima Godwin said, "Ma'am, can a screen time be corrected in a boy of 6 with just supplements?" No, there's nothing like supplement for treating squint eyes. You people should stop listening to all the people that preach supplements. Unfortunately, we doctors, we don't do adverts and we're not allowed to do that. There's a lot of what we call ethics that guide the medical profession. There are things you can do, there are things you are not allowed to do. And unfortunately, people that say all sorts of nonsense online, they are not regulated. So they kind of confuse people. Now, the most important thing to know if your child has a squint is why. Why is the child having a squint? And it is not one size fits all. So there are things that children have, we call it congenital squints, and that we even correct on its own. But there are squints that are due to problems with the eyes. There are even squints that are due to problems in the brain. So it is the most important thing is for us to know why. So when you see doctors, I always tell parents and caregivers who I advise online, whenever you see a doctor or whenever there is a symptom, the most important question is why. We must always ask why. Why does the child have a squint? I think that's the difference between doctors and non-doctors, or experienced mothers. So you tell them your child has cough, just go and give cough syrup. They are not curious as to why is the child coughing in the first place, because there are many causes of cough, for example. And so there are coughs that a child will have, we don't even need to give any treatment. There is a cough that a child will have is asthma, we need to nebulize the child. There's a cough the child will have that is an heart disease, there's a hole in the heart, or the child is in heart failure. And so there are different things, or the child has something in the airway that we need to take out. So the question doctors always ask is, why is there a symptom? And one thing we must realize is that there is no one symptom that it is just one thing that will cause it. There are very few conditions like that. So for example, if a child has a squint, there are many things that could cause squint in the eyes. So we need to know why is the child having a squint. And the best person to do that is the ophthalmologist. That is a doctor, a surgeon who is trained to examine the eyes. Please, this is not an optician, it is not an optometrist, it has to be an ophthalmologist. So there are a lot of people that does eyes condition. So there are people like optician that just give you your glasses. Optometrists do a little bit more, but the ophthalmologists are the doctors, and they are the ones sometimes that will operate the eyes if there's a problem inside the eyes. So they have a way of looking inside the eyes beyond what you can see to the back of the child's eyes. So if your child has a squint, you must underline the word must. You must see an ophthalmologist first. The ophthalmologist is the one to tell you, okay, this is just a congenital squint. There's no problem with the eye muscle. There's no problem behind the eyes. There's no problem in the brain. And then, okay, we can watch. Or this is something wrong and we have to fix it. So that is the most important answer to the question. Thank you, Lorita Mall. Thank you for joining us on Instagram. Thank you so much for your kind comments. Okay, so we really definitely need to know the why. That is the most important thing. So don't rely on supplements. Everything is supplement. Let me just say it like that. I don't go overboard on supplement issue, but let me just add by saying most condition medicine are not supplements treated or treatable. Let's put it that way. And I would really prefer you see a doctor first. And if they tell you there's nothing wrong, and you want to give your child supplements, as long as it's not something harmful, well, you are in your right to do so. But please know what we are dealing with first. And some things are very sorry, some of that some squint that we need to patch the eyes, because if you don't patch the eye, that child will lose the function in the eyes. And there's actually nothing wrong with the eyes, but because the child is not using the eyes, and in medicine we say what you don't use, you lose. So if your child doesn't use the eyes, that child will lose the eye. And there's actually nothing wrong with the eyes, just because the child is using only one eye and not using the other one. So it's very important that you see the ophthalmologist, and so that they can figure out if there's anything wrong, and they can also treat it. Or if there's something they don't need to treat, they will also let you know. It's very, very important. Adefulure Misola, my namesake, Precious. Hello, Doc. It's been a while. Okay, how are you doing? Thank you for all you had to we mothers. Okay, thank you. God bless you. God bless you too. Is there diphtheria immunization? Of course, yes. I don't know. I don't know whether you are the same person that asked that question in our group. Of course, there's diphtheria immunization, and this question really bothers me. Okay, and I will tell you why it's bothering me is because it shows that we don't know the immunization we are taking for our children. We just go get those immunization we don't know. So there's what we call Penta vaccine for those of us in Nigeria. In UK, I think it's Exa vaccine, about 6-in-1. But in Nigeria, we have 5-in-1 vaccine that we give at 6 weeks, at 10 weeks, and at 14 weeks. Now, there are 5 vaccines in one. One of those vaccines is diphtheria. It used to be DPT in the days when we are giving the triple vaccine. So we give D. D stands for diphtheria, okay? The P stands for pertussis, and the T stands for tetanus toxoid. So I hope you know your child is also getting tetanus toxoid at 6 weeks, because somebody was asking me, does my child need tetanus toxoid vaccine? I think I need to do another teaching on immunization. It shows that mothers don't even know the vaccines. Of course, we're not going to give newborn tetanus vaccine. The newborn is going to get the tetanus toxoid vaccine as part of the Penta, and it is given at 6 weeks, 10 weeks, and 14 weeks. In some countries, they give booster doses at 18 months and 5 years. In Nigeria, currently, we don't have the booster. It would be nice for us to have, but we're working hard, and I'm sure our government, Federal Ministry of Health, and the National Program on Immunization, and the National PAC Development Agency, they will get to it very soon. But the reason why they are now excited to get to it soon is that even the ones that they are giving us for free at 6 weeks, 10 weeks, and 14 weeks, majority of us are still not taking those ones. Our immunization coverage is so low in Nigeria. So we really need to work hard on making sure our children get the vaccines, okay? So the diphtheria vaccine, it is part of the Penta vaccine. If you're in UK, it's part of the Exa vaccine. And it is given as one dose. So the Penta vaccine contains the diphtheria vaccine, the pertussis vaccine, the tetanus toxoid vaccine, the hepatitis B vaccine, and the Haemophilus influenza type B vaccine. So you have 5 of those vaccines in one, and it is given to children at 6 weeks, 10 weeks, and 14 weeks. Okay. For older children, we should be giving them booster doses. I know we have a diphtheria outbreak in King's College and around Lagos recently, and I think we lost a child because either the child was not immunized. I don't know the details, so I can't comment, but some people we know they don't take vaccines, and or some will take at 6 weeks, then they forget to take the remaining. And of course, like we've been saying, we need to be giving our children the booster doses, which we have currently not started giving them, but I hope that very soon we will start to give our children boosters. And so, Baby Sola, my namesake, I hope that is clear. So you didn't tell us the age of your child, but if your child has taken the Penta vaccine at 6 weeks, 10 weeks, and 14 weeks, your child is protected at least till 18 months. The immunization tends to wane from 18 months, which is when we need a booster. But currently it's not available. But I guess you can pay for the booster if you want. But I don't think they will give you at the health centers. All right. All immunization are available in health centers. All immunization are available in health centers, your general hospital, your teaching hospitals. Immunizations are available and they're free. And bonus answer for those who always ask me questions about they ask me to pay so thousands of naira for immunization. You don't have to pay a kobo for any immunization in Nigeria. Immunizations are free in health centers. Go to your health center, and the health center vaccines are actually better because they get it straight from the source and they use it and they don't store it. So you can be sure it's not, the cold chain should not have been broken Unlike in some of the private hospitals, they stuck it in the fridge, and sometimes they don't have power, and so you are not sure of how the cold chain has been maintained. So, which could be one of the reasons why children will get injected with vaccines, but they are not immunized because the cold chain has been broken. Buchi Paul, good evening, ma. What could cause a 6 weeks old baby to be crying too much? Instagram people ask questions. No, I can't see any question. Please ask your questions. It seems like you're all just listening, but it's fine if you don't have any question. Okay, this is a very broad question. There are many reasons why a baby should cry, and that's the only way the baby communicates in a 6 week old. The only communication they know is crying. So they are hungry, they're going to cry. They are wet, they are going to cry. They want to poo, they are going to cry. They want to wee, they are going to cry. They are full, they're going to cry. They want to sleep, they're going to cry. They are hot, they will cry. They are cold, they will cry. They are hungry, they will cry. They can have things like colic, but they can also be sick. And if they are sick, they also cry, and they can have what we call inconsolable cry. So there are many reasons why babies cry, and that is part of being a baby. There's nothing wrong with a baby crying. But if you think a baby is crying too much, you have already done the usual thing. What we doctors would call triage. You have already tried to figure out why the child is crying. The child is not hungry. You fed the child. The nappy is not wet, and all that. Then, if you're not sure and the child is not stopping crying, you can come and see us. Usually, we will think of things like colic. Colic is one reason why a healthy baby who has no other illness or no other issue will cry. May cry for 3 hours non-stop for 3 days in a week for 3 weeks. That is the definition of colic, and there's no cause for colic. And most of the time, there's no treatment as well. It's something that children will outgrow. So you just try and just make them comfortable. What works for one child? Some children like for you to just hold them and snuggle them. Some children like for you to pace back and forth. Some children like for you to play all these white noises. Some children just like you to drive them around. Do whatever works for your child. Most of the time, the good news is that colic will go away and it will stop. Okay, but like I said, if you are not quite sure and you think you have done all that you can do humanly possible as a parent and the child is still crying, you can come and see the pediatricians, and we can try and help you figure it out as well. All right. Sound like a father asking that question, and you should be helping your wife as well. So I always tell mothers, if your child is crying too much, take a break. Let other people take care of the child as well. You take a break, come back, because sometimes it can make a mom to go into postpartum depression, and some mothers harm their babies, in the process. So always ask for help. This is why Omugo is a good. There are a lot of African cultures that are terrible when it comes to childcare, but there are lots of positive ones as well. And this Omugo concept of the mother of the grandmothers coming to help is a very positive one. If they don't try and introduce all the myths and fables and stuff, but if they just help out the new mom, that's a very positive thing to do. All right. Okay. Next question. What's Ojo? Is it okay to use pseudo cream and Vaseline every time a baby's diaper is changed? Yes, you should always use a diaper cream. You don't have to use the two. You can use the pseudo cream. You can use the Vaseline. You don't have to use the two together. They are both what we call barrier kind of cream that you can apply on the diaper area. The reason why it's important is, when your baby poo or when they wee, they are generated waste products, and that waste product comes in contact with the skin of the baby, and it can irritate the skin, which is also, so it's not enough for you to use the diaper cream, because a lot of mothers say, oh, but I'm using pseudo cream, I'm using Vaseline. You must change the nappies as soon as possible, and you don't wait until nappy is dropping off the child or there's a poo before you change. I understand there is economic uh crunch and all that, but please, you will spend more money treating nappy rashes. So it's not just applying diaper cream. So there are lots of factors when it comes to nappy rashes. You need to change the nappies themselves frequently. Sometimes babies will need nappies changed up to 8-12 times a day. I know it's a lot, but that is the truth. We should change it when it is wet and when it is dirty. Some of us only wait once it's dirty. You must change it when it is wet. And the earlier you change, the better. But before you get to change, so that Vaseline or pseudo cream creates a kind of a barrier between the skin and the waste product so that it doesn't irritate the child too much. And so, please don't use powder in the diaper area. Some of you will use Vaseline and you apply powder. You have just created a paste that will also irritate the skin of the child, which is what we're trying to avoid in the first instance. So please, no powder at all. If you use only powder, the powder will mix with the urine or the poo, and that will actually irritate the child faster. So change the nappy frequently. Use a barrier cream like pseudo cream, like Vaseline, like zinc oxide. Lovely, no powder in diaper area. And use hypoallergenic. If it's better, use water to wipe, to clean the child's bum. But if you want to use wipes, use hypoallergenic wipes that doesn't have a lot of smell or chemicals. All those nice smelling stuff that we use for our babies, there are actually a lot of chemicals that are very irritant to the skin of the children. So you should avoid them. All right, okay. Uh, your baby is stooling, not really what treated to If your baby is stooling and the anus is reddish, you need to see a doctor because that reddish is likely a sign of infection, either infection from the diarrhea itself, the what, even though you say it's not watery, but we don't tend to get red anus unless there's something. So it's either there's the diarrhea, which is likely an infection of its own, causing the area to be red, or it's a diaper rash. There are two kinds of what we call diaper or nappy rashes. There are nappy rashes that are due to irritation because you're not changing the nappies, you're not using barrier creams. But there are nappy rashes that are due to infection. So a fungal infection like candida and all that. And those ones need to be treated. So if you are doing the right thing with your nappy change and you're using pseudo cream or Vaseline and you're doing all the right things and your child still have rashes, you have to see us because it could be something that is an infection and that is not going to go away with you changing nappies. We need to treat it with the appropriate antimicrobial, whether it's an antifungal, whether it's an antibacterial, we have to treat it as well. So if the anus is reddish, it is swollen, you need to take that child to the hospital. That is not something that is nappy rash or anything. It's not something that has to do with your diaper change or the pseudo cream or Vaseline. That child is having something going on that needs to be treated. It's really with that swelling that needs to be solved. Okay, I got one or two questions on Instagram. Let me quickly take that before they disappear. Um, Osa de Sonia. Okay, good evening. My 19-month-old crisscrosses his fingers. Crisscrosses his fingers. I read online that it's okay as he's exploring. He's not in any pain. Should I be worried? You don't need to be worried. Okay. As long as the child is not having his finger permanently crisscrossed, I will not worry about it. Okay. Then Larita said, "Thank God you do, doc. There's this injury that appears inside the nose or the side of the mouth on both adults and children, and they usually see it's fever." Okay, I think you're talking about herpes labialis. Okay, so or cold sores. People call it cold sores. If that's what you are talking about, it's when they say it's a fever that causes. Now, technically, the word fever to a doctor just means hot body, high temperature. So fever is not a disease, it's not a diagnosis, it's just a description of the temp of how your body feels. So you can have fever, and it's not only malaria that causes fever, there are many things that can cause fever. So but in Nigeria we tend to use the word fever almost synonymously or interchangeably with malaria, which is a very dangerous assumptions. And because people just think once you have fever you have malaria, and that's the only thing we always want to deal with. So but if you have cold sores on the angle of your mouth, it is usually what we call herpes labialis, which is a viral infection caused by the herpes virus. And most of the time people have the herpes virus already in their body, and it is what we call dormant in their body. But when they are sick for other reasons, if it could even be malaria, it could be any other illnesses, and their immunity drops, then there's what we call reactivation of that herpes, and it will come up with cold sores on the side of the mouth or the lips and all that. Usually what we normally do for it is to treat the reason why the person is sick in the first place, that is causing the reactivation of the cold sores. and sometimes that is all. But if you have a cyclover, which is an antiviral medication, I think we are now beginning to have it in Nigeria now. We don't have it for a long time, but we can also use the cyclover cream or the cyclover tablets. That is the actual treatment for it. So it's a diagnosis on its own. It's a viral infection caused by herpes. It's almost the same kind of family of infection that causes the chicken pox. They are close family members, but they are not exactly the same. But herpes is what causes those cold sores. And anytime people's immunity are depressed, even when you are stressed, some people, you notice when you are stressed, you come out with cold sores because your immunity has gone down, and you can have it. And there's treatment for it. So if you don't know, you can always get your doctor to write the a cyclover for you. All right. Uh, okay, where am I? Okay, yes. Okay. Dima is thanking you for the detailed answer about the screen time. Okay, thank you. Please, I will be interested in you seeing that ophthalmologist and giving us an update. It's okay to post on our Facebook group. I just always want to know some cases to be followed up. Okay, Eze Faith said my baby of 9 months has been stooling for 5 to 6 days. I've given ORS. She now poop 1 to 2 times a day, but still a bit watery or paste. You are confusing me because it's either it's watery or it's a paste. It can't be the two together. All right. Anyway, there's no problem. If your child is still passing watery through, keep giving the ORS. And I hope you're giving oral sync. You give the child oral sync for 10 days, whether the poo has changed to normal or not. You need to keep giving ORS as long as the poo is watery, and give oral sync. Usually between 10 to 14 days, it will clear. It shouldn't be more than 10 to 14 days unless there's something else going on there. All right. All right. You might say, lastly, ma'am, sorry to bother you. You're not bothering me. That is why I'm here to answer any question you have. My daughter is 4. She has this reaction whenever it rains, itchy, bumpy on her legs. Okay. We call that popular urticaria. Whenever she scratches, the most important thing is to avoid the trigger. So, popular urticaria is a form of like an allergic tendency or allergic kind of skin condition that when you are exposed to certain things, you come up with rashes. For example, I remember when I was younger, there's this flies, like where if you go inside the bush, there's this tiny fly, they call it tim or something. Once it bites you, you start having that kind of reaction to it. Some people will have that bites and it won't even bother them. But some people, once they bite them a little bit, they come up with all these bumps, and then it's itchy, and then you scratch it and it turns to sores. So the most important thing is to avoid. For example, you have noticed that whenever it rains, so maybe I don't know, is it your child is walking inside the rain or whatever, playing with water in the rain? You have to avoid whatever it is that trigger that reaction in the child. There's no particular solution to it. But whenever the child is having an episode, we can give an anti-allergy medications that will reduce the itching, that will reduce the bump. In terms of the marks that it leaves behind, there's nothing you can do about that. Most of the time, as the children gets older, it will fade away on its own. But the most important thing when it comes to popular urticaria is to avoid any trigger, anything you notice that whenever your child is exposed to it, they start to itch, they start to have those bumps, they start to have the sores. Avoid them. Sometimes people don't know as well, so they can't avoid. But if you can avoid, you avoid. That is the solution to that. What to say, just say thank you for your explicit explanation. Thank you. Okay, yeah, the pseudo cream question. Okay. Princess Onyi, good evening. My two kids, 12 and 10 months, have this stomach pain. Okay, one did endoscopy at load, nothing was wrong. The other was told they have umbilical hernia. Okay, but because it was small, last year both had appendicitis removed based on abdominal scan from clinics. After some time, the pain came back. Da, da, da. One, especially since it's finished eating. Anyway, the issue is that you've been seeing some doctors already for this abdominal pain, so you can keep seeing the doctors that you've been seeing. But the truth of the matter is that there are some abdominal pain that there's actually no cause for the abdominal pain. So we have what we call functional abdominal pain, and I wonder whether your children are actually having functional abdominal pain and they are being over treated, because each time you complain of abdominal pain and you take your children to the hospital, we will always have to look for something, and we are because all the things you've listed, there's really not none of them that is like significant cause of abdominal pain. I find it very hard to believe that two siblings would both have appendicitis at the same time and both will need surgery. Most people have appendix that could be inflamed. It doesn't mean they need surgery and all that. But if they are complaining of abdominal pain and that was the only thing people will find on the scan, then of course they will just go and, okay, let's go and take it off. At least now that they've taken off appendix, you can't complain of it's appendicitis again. So just get used to the fact that there are causes of abdominal pain, that there is no cause. We call it functional abdominal pain. Make sure your children are not constipated. Constipation is the number one cause of all this abdominal pain in children. Make sure they are passing stools that are soft. Make sure they are drinking a lot of water. Make sure they are eating fruits and veggies, and they are having regular bowel movement. That's number one. Number two, pay attention. When do they have the pain? Do they have it during the school period? Do they have it during the holidays? You find all these children that complain of abdominal pain only when the school is in session. Immediately they are on holidays, you don't hear of any pain. So that is anxiety induced abdominal pain. So some children complain of abdominal pain when they don't want to go to school, or whether there's something bothering them in school or something bothering them, and we call it somatization. In other words, when children worry about something, they don't have the words sometimes to express it, or they put it down to a symptom. And the commonest symptom that children tend to use is abdominal pain. So I guess if you have been seeing doctors enough for them to have done endoscopy, that means they've investigated your child for all the sinister causes of abdominal pain and they couldn't find anything. And the umbilical hernia, if it is small, it is not causing any abdominal pain. Most people have even bigger ones and they are fine with it. And so unless it's obstructed, and usually for it to get that big, it will have to be big for it to be obstructed, for it to be strangulated. So I don't think that is the cause of abdominal pain. So I think you just, number one, make sure that the common things, as common as they have, they are what causes most problem. Make sure your children are not constipated. Make sure you deworm them every 6 months. Make sure you are paying attention to their emotional well-being, and that there's nothing really bothering the children that they are trying to get off the mind, and they are now kind of using abdominal pain. So if they're having abdominal pain after food, check that the food is peppery, is anything. I believe they would have tested them for ulcer. If you've been going to teaching hospitals for abdominal pain investigations, they would have done things like H. pylori, look out for ulcer and all that. But if you worry about peptic ulcer disease, because that's the one people tend to have pain after food, then you can still go back and see a pediatrician for that. So if a child is complaining of pain after taking tea, just stop the tea. It's as simple as that. Don't give the child what make the child to have pain. It's not compulsory for the child to drink tea. It's not an essential food. So so sometimes there are some things that don't need any medical kind of intervention. Sometimes we just common sense approach. So if a child drinks tea and complains of pain, I will stop giving the child tea. End of story. Or maybe there's a child allergic to something they say. I don't know. I don't know which particular say you're referring to, but very unlikely, really. I mean, usually if people are going to have also kind of pain, it's a bit spicy food and all this kind of food, but nothing is impossible though. But very unlikely. But it's a very simple thing. If there's a particular food that your child eats and gives them pain, just stop it. End of story. You don't need to worry about that. So, but I would imagine that you can still see your pediatric gastroenterologist and they can keep following them up. There are other conditions that in like UK, for example, they will do like celiac disease, inflammatory bowel disease, and all those kind of screening. We don't tend to have a lot of that in Nigeria. But that does not mean it doesn't exist, but maybe because we are not really testing our children or screening for them. But in other places, that's other things they will be looking out for. But I don't see us having a lot of them in Nigeria. So, but it's a possibility. But I believe your specialist will be in a better position to advise on that. Okay, I think We've addressed that. Sorry, we don't have further, but you seem to have been seeing the right specialist. So I'll just say you can always go back to them for follow up reviews as well. Okay. I hope I've not missed anybody's questions, but it seems like I've answered all the questions pending. Just checking. And if you're on the group, please make sure you don't drop your question on the group because I won't see them. You have to drop your question on the under the video directly, then I'll be able to see them. I'm just checking. Okay, so the question that's been on my mind is that of the immunization. So while I'm waiting for more questions, I'll just address the issue of immunization. So the immunization we give in each country depends on what conditions we deal with in that country. Last week, I answered a question about a mom who was asked to pay, I don't know, is it 21,000 or 16,000 for a flu vaccine? And she was like, she doesn't even have the money, blah blah blah. What should she do? Number one, you don't need to take flu vaccine in Nigeria. I mean, I know some of our private hospitals will like to be touche and like to overdo things and like to do a lot of copycat things, but there are things we should not be copying. And one of the things we should not copy is immunization. There are diseases that are worldwide, and there are diseases that are prevalent all over the world, so which everybody takes vaccines for. But there are diseases that are regional, and they are very specific. For example, they're not going to give the people in UK or US malaria vaccine, even though there's no malaria vaccine. We won't give it to them because they don't have malaria there. So there's no use for us to give them malaria vaccine. Exactly. The same thing, we don't have flu like that in Nigeria. We don't have that kind of season like winter where there will be flu, and then if anything is malaria vaccine we should be taking because that's what we have. So there's no reason why people should be forcing the children to take flu vaccine. I've raised this issue um at the level to the highest people who my colleagues in infectious diseases because I was really worried about a number of questions about parents who are really struggling in this economic crunch and who are trying to do the right thing for their children, but and then people are asking them to take unnecessary vaccine and they're actually asking them to pay for it. So there's nothing too much about taking flu vaccine. Your child does not need it, so you should not be paying. And I've told parents, I don't know why some of us like to go to private hospital for our vaccines in the first place. You don't need to go to private hospital for your vaccine. You don't need to pay a dime for vaccines. Go to your health center. There's an health center within 30 minutes of your house in Nigeria. Walk to any of them. In other words, health centers are places you can literally walk to. So, and we deliberately have it that way so that people won't complain like, oh, I can't get vehicle or transportation. That's why I didn't get vaccine. So you can literally walk to the closest health center to your house. They usually are either in the ward or something. They have a lot of distribution that is easily accessible. So go to them and take your vaccines there. Of course, there are a few vaccines that the government is not yet paying for that are okay for you to take if you have the money. So if you want to take chickenpox vaccine, for example, that is fine. If you want to take mumps, MMR, mumps, measles, rubella, we give you measles already. We don't think mumps and rubella are that significant, but if you want to take those vaccines, those are ones are okay. So it's okay for you to take them. Those ones you have to pay for those ones. But things like flu vaccine, don't pay for it. Don't take it. It's unnecessary and we should not be giving it to our children in Nigeria. Things like cholera vaccine, it is not even recommended for anybody. Cholera vaccines is recommended for those who are travelers to an area where there's cholera outbreak. So your everyday child does not need to take cholera vaccines, you know, and it doesn't really do much. Typhoid vaccine, You don't need to take those for children again. It's meant for those who are traveling or those who are workers, food workers who have typhoid fever and all those ones. Yes, they can take it, but it's not recommended for children. Hepatitis A as well. So these are WHO recommendations. There are some vaccines that we don't recommend for children to take. So if you go to private hospitals and they putting all these bills on you, you may want to be sure first whether you should even be taking them before you start paying and losing unnecessary money to all these people. So that's just free information, public service announcement for those who are confused. But if you don't want to be confused, just go to the health centers, take your immunizations there, and it's free, and they won't have to charge you. Of course, we can still expand on our immunization we're really trying to get the government to introduce the booster doses. That will be helpful, but we have not yet gotten there. But we've now introduced the human papilloma virus vaccine, the HPV vaccine. Please, let's make sure that we take the HPV vaccines for our children from the age of, I think it's 9 years. We should take them. That will protect the girls against cervical cancer. HPV, chronic HPV infection is in most common cause, or is associated in almost 98% of cervical cancer. So cervical cancer is the second most common cancer in women, next to breast cancer. So if we can get that, if we can prevent cancer by just taking vaccine, I mean, how awesome is that? So please, let's make sure we remember to take our girls, because I know there's a wide gap between the last immunization at 15 months and the HPV at 9 years. So there's a huge gap, and most of us parents forget. But I think we should, now that all of us are using smartphones, we should put it somewhere in our reminder to say, remind me to take HPV for my daughter at 9 years. We should also take for the boys, though they are not as much risk, but they also can have HPV infection. So let's take for the boys, and also let's take for our girls as well. So I think those are the updates I have on immunization, and the issue about whether you should be taking certain vaccines. Especially if you have to pay, for any vaccine, please ask us first. It will pain me if you pay unnecessary money and give your child unnecessary injection and all that on top. So just ask us whether you should pay. If anybody has to pay for any vaccine, ask pediatricians whether should I be taking that vaccine in the first place. Because some of the private hospitals, with all due respect, are just after the money they want to make. They are not really looking, they are not really asking whether should we be doing this or not. So not all private hospitals, of course, but some are doing it, and I'm just wondering whether they are thinking about what they do. So please always clarify and ask us. Okay, I think my time is almost up and I don't have any questions. But if you still have any questions, feel free to go to Ask the Pediatrician Facebook group. You can ask questions on our group from Mondays to Saturdays, and we will be there to answer your question. Please be patient with us. Give us at least 24, 48 hours to address your question. But if after 72 hours we have not answered your question, you can send us a reminder or send another one so that we will know. But I'm so sure we'll try to answer question within 48 hours, of course, of you answering the question. Of course, if a child is sick, please take the child to the hospital. Take sick children to the hospital. It's okay to ask us, but please take sick children to the hospital. If a child has any of those what we call pediatric emergencies, a child is not breathing, a child is having convulsion, a child has suffered a huge burns, a child is bleeding massively, you can't have those on Facebook. You have to go to the hospital. We can tell you a few things, but you still have to get to the hospital, because it's not everything that we can solve online. So if your child is not breathing, your child is weak and getting so dehydrated, they are going into shock. You have a child that's taking swallow poison or a foreign body, you have to go to the hospital. But if you just want to know, like some of the questions we've answered today, should I take this vaccine, or when should I take this vaccine, or what should I do? Those general kind of, your child is well, but you just want to know or clarify some symptoms. Yeah, that one is fine. But if a child is very ill, please let's seek medical intervention on time, because we doctors, we pediatricians, we only care, but it is God that will heal the children, and you will help us massively if you bring the children to us on time. Okay, and that is it. So thank you so much for joining me. Watch out for ATP 10th anniversary next month. The whole of next month, we're going to be celebrating our 10 years anniversary, and we're going to be looking for you to support us in your own way. And watch out for all our program of events for the anniversary. But till then, till I come your way again next week, I think I'll be doing a teaching maybe this Thursday on immunization. I've asked so many questions on immunization. I just think we need a refresher. So I think I'll put up a teaching on Thursday on our ETP webinar so that we can learn a little bit more. But remember that all these past videos, they're available on this same platform you're watching, on Instagram TV, on Facebook. Though Facebook will take them off after 1 month, but they are always permanently available on our YouTube channel, or you can also listen to them on our podcast. So feel free to watch all our past episodes. You can go to our website to learn, to read, and you can ask questions on our Facebook group. So have a wonderful evening, and it is bye from me. Bye bye.